Hi there, welcome back to Dr. Riam Academy. Today we are going to talk about important pathology that affects women in reproductive age, and this is adenomyosis. Our focus is on the diagnosis of adenomyosis, specifically exploring the role of junctional zone in the diagnosis. And our question is that junctional zone valid diagnostic tool? Let's see. But before we jump into answering this question, let's explore first what is junctional zone and what role it plays in the diagnosis of adenomyosis. So, what junctional zone is? If we look at this image, this is a sagittal view of MRI. It demonstrates the normal uterus and more specifically the myometrium and consists of the outer myometrium, which appears as a red, and the brown inner myometrium, which is called the junctional zone. And it's clear that the junctional zone is a distinct interface between the endometrium and myometrium. And in addition to that, the junctional zone uh, is hormone dependent part of the myometrium, and also it change according to the menstrual cycle phase. And the normal thickness of junctional zone is up to 5 millimeter. This transvaginal sagittal view of normal uterus, it reveals hypoechoic halo of junctional zone and hyperechoic endometrium and echogenic outer myometrium. Now that we have explored the junctional zone, let's dive into adenomyosis. And adenomyosis is a benign pathology of the uterus, and it defined as abnormal invasion or growth of endometrial stroma and gland into the myometrium. And it can appear as a focal lesion or diffuse lesion, with or without myometrial hypertrophy. And building on what we have covered, let's take a closer look on what the junctional zone appear on transvaginal ultrasound. The morphologic uterus sonographic assessment MOSA group divides the myometrium into three layers, as we can see here in the picture. The first layer is the inner myometrium, which is called the junctional zone, middle myometrium, and outer myometrium. The middle myometrium is located between the inner myometrium or junctional zone and the outer and the arcade vessels. And the outer myometrium is located between the arcade vessels and the uterine serosa. Again, if we look to this image, we can clearly see the hypoechoic halo of inner myometrium or junctional zone surrounding the hyperechoic endometrium. And the insight we gained from the MOSA group can be explained through this schematic representation of direct and indirect features of uterine adenomyosis. So the direct features, as we can see here, is myometrial cyst and hyperechoic islands, and also echogenic subendometrial lines. All these three features are direct pathognomonic features of adenomyosis. While, on the other hand, the indirect features of adenomyosis, as we can see here, the asymmetrical thickening, globular appearance of the uterus, interrupted junctional zone, fan-shaped shadowing, increase the vascularity of inner myometrium, and irregular junctional zone. In this image, you can see the asymmetrical enlargement of the myometrium and increase the thickening of anterior uterine wall and presence of the myometrial cyst in the posterior wall, in addition to increased vascularity of the myometrium in the anterior wall. Again, you can see the asymmetrical thickening of the uterine wall and the uh, globular appearance of the uterus. This image also shows the subendometrial buds, the hyperechogenic islands. Now we will explore the appearance of the junctional zone on MRI and this image uh, for normal uterus. The high signal intensity located centrally represents the endometrium, and the low signal intensity is the junctional zone. And there are prospective studies on the junctional zone characteristics found, found that a 12 millimeter is the cutoff to diagnose adenomyosis and had a sensitivity of 65 up to 93% and specificity of 85 up to 93%. This sagittal T2 MRI image shows a focal thickening of junctional zone, both ventrally and dorsally, and this consistent with adenomyosis. Although the maximum thickness of junctional zone ventrally is less than 12 millimeter, but the focal thickening of the lesion suggests adenomyosis. And here we can see the direct features of adenomyosis, which is myometrial cyst and subendometrial bands or lines here, and the hyperechoic islands. Thank you so much for watching, and I will see you hopefully in the next video. Bye bye.